is responsible for over 1 million deaths. Now, what happens? Remember, I said something about oxygen and carbon dioxide exchange that occurs in the lungs when I was talking about the physiology, how the lungs function. Now, when a patient or when someone smokes, what happens is that this smoke competes with oxygen. Now, when they get to the lung, they compete with oxygen. Now, it means that there will be carbon monoxide entering into the lung, into the bloodstream, instead of oxygen entering into the bloodstream. The patient will still receive oxygen, but it will be reduced because the substance from the smoke will be competing with oxygen in the lungs, and they will be like competing for the place of in the hemoglobin or in the blood. So these substances or these gases become part of us. They enter into the bloodstream and they are distributed around the body just the same way oxygen would have been distributed. Now, when a patient continues to smoke, this smoke affects the cilia cells. I mentioned something about the cilia cells. Now, they affect the cilia cells and they start to degrade it with time. There's something they call smoker's cough. Probably you've heard it before. And for those that haven't heard it before, I will explain what smoker's cough is. When a patient smokes, these substances destroy the cilia cells. Now, the cilia cells, they function by excreting or cleaning up the respiratory system. Now, when the cilia cells, when they cannot function properly, what happens? Mucus, substances, these gaseous substances, these carcinogens that causes cancer, they remain inside the lungs. Now, when the patient sleeps at night, because when you are sleeping, you are not smoking. When the patient sleeps at night, these cells, because our body is made to regenerate, to fight back, these cells, they activate back in the night and they start to clean again. They start to clean. So when these patients wake up in the morning, we call it smoker's cough. They cough early in the morning and they produce a very dark sputum. Some patients come to the hospital and they were like, every morning when I wake up, my sputum is very, very dark. The first instance is to ask, are you a smoker? Yes. We already know that probably he's having a dark sputum because of this mechanism I just explained. The body tries to regenerate in the night and helps you clean back your lungs. But when you smoke with time, when the patient continues to smoke, they continue to destroy these cells. They continue to destroy these cells until they can no longer function. And what happens when they don't function? These carcinogens remain in the lungs. And when they remain in the lungs, it changes the structure of the lungs. So when this structure changes, it changes the DNA. And abnormal cells are produced. Now, when abnormal cells are produced, because our body, the truth is that every cell in our body is recognized by our own DNA. So this abnormal cell, our body doesn't recognize it. And they grow rapidly. When they grow rapidly, they occupy that part of the lung and they are very deadly. That is what we call lung cancer. So as they grow with time, they destroy the lung tissue. The patient start having problem with breathing. The patient start having problem with we call it dyspnea. The patient can no longer breathe properly. And the patient start having chest pain, coughing out blood. These are one of the signs. So, next slide, please. As you can see, I try to bring out a little bit of the signs that you can see. Wheezing. Wheezing is when someone is breathing. Normally, breathing is effortless. When you breathe, you're not supposed to know that you are breathing. You're not supposed to have a knowledge that you are breathing. It's supposed to be effortless, without knowing. You breathe with ease. Now, when you start breathing with consciousness, and there's this sound they produce, like, that is what we call wheezing. When a patient starts having wheezing, shortness of breath, persistent and worsening cough, voice changes, and frequent pneumonia. Pneumonia, as we know, is an inflammation that occurs in the lungs. When the pneumonia becomes too frequent and the patient starts having chest pain, it's a prerequisite or it's a sign. It could be a sign. Why this thing can also occur in other illnesses, it's a sign of lung cancer. I will show you how the lung will look like years after a patient smokes. If you look at this picture very well, that's a healthy lung and a lung of a patient that probably have smoked for like 40 years. Yeah, some of us may say, hey, yeah, but the truth is you don't know how these things run. Before you know what's happening, the person has started smoking for 1 year, 2 years, 3 years, and the person can no longer stop. It destroys the lungs, and that is how the lungs look like. There are so many ways, there are a lot of treatment today for lung cancer, depending on when the lung cancer is diagnosed. In most cases, it is diagnosed late. They are different. We have stage 1 to stage 5. Most patients actually start feeling this pain because the body is trying to adjust and trying to heal you. You don't even know that you already have such things. No one goes every day to the hospital to do an X-ray. No one does that. So when you start identifying these problems, probably most patients come to the hospital at stage 4 cancer. And it's unfortunate to know that a patient with a lung cancer with stage 4 or stage 5, the lifespan at that point of diagnosis is now 5 years. It's very, very sickening to know. I met a patient when I was doing my hospital practice in Duisburg, and she was a private patient. She had a private room, and I was with a doctor. So I went with this doctor to her room. We diagnosed her, they spoke to her. I was one side looking, so many things were going through my head. And she saw me and started laughing. After laughing for a few minutes, she started crying. I didn't know what to do, I didn't know how to react. So when we left the room, I called my doctor to one corner and I asked him, what is the prognosis of this woman? I was just curious, I wanted to know. And he looked at me and I was like, if everything is good for her, she has 2 more years. And I went back. The next day I saw her, I didn't even know how to react. And some of them will look at you and tell you, I wish I never smoked. I met a patient, he told me, I was asking him questions, he was asking me, but asked me, do you smoke? I said, no. He said, that's the best decision you've made in your life. Because at that point, when a lung cancer metastasis means that particles of this cancer spread to all other parts of the body. At stage 4 or stage 5, the particle begins to spread to other parts of the body. We call it metastasis. Now, when it spreads to other parts of the body, at that point, unfortunately, medically, I'll use the word medically because there's nothing God cannot do. Medically, there's no cure. There's no cure. The only thing that can be done for that patient is to improve the quality of life and give him or her a few years. Treatment like chemotherapy, radiotherapy is our option. But if the patient is diagnosed in stage 1 or stage 2, there are some people that their body shows symptoms very quick. Surgery like lobectomy. From the beginning, I showed you that the lungs has 3 lobes and the other one has 2 lobes. Now what they do is, we take out 1 lobe of the lung where the cancer is located. If it has not metastasized, if it has not spread to the other part of the body, we take it out. So probably the patient is going to have, let's say 1.5, but it's okay because every paired organ in the human body can function alone. So it's still okay. So this is a very, very dangerous illness. So I will continue. Another thing I want to talk about is atherosclerosis, or basically constriction or narrowing of our blood vessel. If you look very well, you see I have different pictures. Here is the normal blood vessel, and here is blood vessel that is becoming atherosclerosed with time. Atherosclerosis is the narrowing of the blood vessel. Now, what does our blood vessel do? It transports oxygen or blood vessel or nutrients to all parts of our body. Because for our body to function properly, we need oxygen, we need nutrients, we need glucose. So this blood vessel transports blood rich in oxygen and nutrients to other parts of the body. So, but for a patient that smokes, what happens? The smoke contains substances that destroy the lining of the blood vessel. They destroy the lining, the inner walls. They destroy it. And when this occurs, the body instinctively tries to repair because of our defense mechanism. Our body normally has a defense mechanism. The body instinctively tries to repair. What it does is it gathers substances, especially fatty acids, or we call them cholesterol. These substances are gathered, and the body is